Welcome, everybody. This is Professor Coombs. I am your Nurse Ninja. And as promised, this is going to be a short video on how to do some deep breathing exercises to reduce test anxiety. When we get nervous, we go into that sympathetic state. Our heart gets going faster, our blood pressure elevates, and we get very fast. We get very kinetic. We can do things very quickly with that level of adrenaline in our system. But it's not really great for fine motor skills or for pulling out complex things that you've been studying and learning. So it can get in our way when we're doing test taking. As nurses, it can get in our way in a lot of situations. One of the funny ones that I talk about in lab frequently is there's a crisis on the unit and you're the student nurse and your nurse sends you to the storage closet to go get a non-rebreather mask. And you walk into the storage closet and it's just a wall of stuff. And all of a sudden your brain doesn't work and you don't know which one is the non-rebreather mask. So I always liked very easy to identify visual cues like, oh, the non-rebreather is the one that has this. And then I just have to see it and know it because our higher functioning in our brains doesn't really work really well in that high anxiety state. And that's when we take tests, right? We have to have good recall of all that studying. And that test anxiety can get in our way of recalling it when we need it and also of learning it to begin with. If we're stressed about learning the material when we're trying to learn it, we're not going to retain it as well. So what we're going to do here is we're going to do some deep breathing exercises to help get us back into more of a parasympathetic state. It doesn't mean it's like going to be suddenly perfect sunny beach, calm happiness, but we're going to try to pull ourselves back out of the anxiety and let ourselves settle back into a more receptive state. And that state of receptivity, of openness, like anxiety is a tense, clenched fist. Reception is, oh, now I can receive learning. Now I can, retrieve learning. So let's start with that. I'm going to ask you to sit up straight. We were built anatomically vertical for a reason. Tuck your chin to help elongate your spine up through the crown of your head. If you're able to relax and put your feet flat on the floor, you can rest your hands in your lap or on the arms of your chair, but try to maintain a nice vertical posture. It helps us align, it puts us into a structurally stable place so that as we physically relax, we have a good balanced structure to relax into. All right, so we're going to start with just taking some deep breaths and shifting our focus to our breathing. Breathe in through your nose, way down deep into your belly. Pause. Breathe out through your mouth. And pause. Next breath, breathe in through your nose. Pause. And out through your mouth. Pause. Continue that breathing cycle in through the nose. Pause. Out through the mouth. And pause. And don't worry if that cycle is difficult to do. Just allow yourself to start to explore your breathing and allow for that deep breath in to take a little bit longer this time. And allow yourself to be at peace in the pause a little bit longer. And allow the out breath to relax and leave your mouth, taking just a little bit longer to do that. And then see if you can sit with your lungs empty for just a second longer this time. Continue that cycle of breathing on your own, breathing in, pause, and breathing out. Pause. Now that your focus is on your breath, we're going to continue that breathing and we're going to use it to help our bodies physically relax. Taking a deep breath in, and this time, let that breath come in as if it were coming in through your nostrils and filling up your head, your cheeks, your neck, your chin, your chest, as if we're filling up the top 1/3 of your body. And let that breath swirl around in there until it is time to breathe out. And with your out breath, allow any tension you're feeling in that top third of your body. With the next out breath, just let that tension relax. And go ahead and do that to the top third of your body 3 times. Each time, letting go of just a little bit more tension. The next set of breaths, we're going to breathe in and allow that breath to swirl in and fill our head, the crown of our head, our ears, our cheeks, our neck, our chest. And now let it swirl down into your middle section, the middle third of your body, your biceps and forearms, your belly, your back, your hips, your thighs. And as you breathe out, notice any tension that you feel there and let it start to release and relax away with the out breath. And go ahead and do that 3 breaths into your middle section on your own. Each time, letting go of just a little bit more of that tension. With your next set of 3 breaths, we're going to breathe in and let that breath swirl around our head, our neck, our chest, our belly, abdomen, hips, arms. And now let it swirl down into the bottom third of your body, your hands and fingers, your knees, your calves, your heels, all the way down in the balls of your feet and your toes. And as you breathe out, relax and let go of a little bit of tension in the lower third of your body. And with each of these 3 breaths, each out breath, let go of just a little bit more. And you can go ahead and wiggle your fingers now, wiggle those toes. If you've closed your eyes, you can let your eyes open back up again. And take a moment and just notice. Do you feel the same as you did before we started? Do you feel different? How do you feel different? Do you feel more relaxed? Did you have a headache and you don't have a headache anymore? How's your breath feel? Are you breathing deeper? So this is a traditional Zazen just breathing exercise, mindfulness. You hear it termed quite a bit lately. And this is a practice. So I'm going to invite you to join me to practice this mindfulness each week. I'll post a little video like this for us to do this together. And if you've got any questions, please feel free to reach out. Um, and I hope you've enjoyed this, and I look forward to doing this with you again next week.